Well, KwaZulu-Natal Education Department will tomorrow announce its plans to vaccinate teachers in the province. Last week, Basic Education Minister Angie Motshekga announced that the department intends to vaccinate over 580,000 teachers, admin workers and cleaners at public and private schools over the next 2 weeks starting from tomorrow. Now let's discuss this. We're now joined by KwaZulu-Natal Education MEC Kwazi Mshengu. Mr. Mshengu, always a pleasure to speak to you. Welcome to the show.
Thanks, Flo, and thanks for having us.
As a start, Mr. Mshengu, I thought that the rollout was set to start from tomorrow, but you will then be kind of discussing what your rollout plan is from tomorrow. You'll be kind of laying out or announcing your plans to vaccinate teachers from tomorrow. Is that not a little bit late, considering that my understanding was that the vaccinations were indeed supposed to start tomorrow?
Well, indeed, the vaccination program is starting tomorrow, Flo. What we're doing is some kind of activation and advocacy, where we're working together with the unions and SGBs, basically to communicate a message to say we request all our educators to come forward and vaccinate, while we acknowledge the fact that vaccination remains a voluntary act or a decision to be made by individuals, but it is our view collectively in the sector that for us to achieve stability in the sector, it is important that educators do come forward to vaccinate. It's a safe thing to do. That is why we're launching some kind of an activation program tomorrow. But it will be starting tomorrow, the rollout. There are a number of schools that have been scheduled to start tomorrow in terms of the vaccination.
Yeah. Of course, we heard from the Minister of Basic Education about the vaccine rollout plan for the country. Now it's obviously time for each province to focus on their own rollout strategy. What's your plan then, particularly when it comes to rural schools, which there are very many of in your province? Can you talk to us about that plan? And I'm sure it forms part of what you'll then be discussing tomorrow.
Definitely, Flo. In fact, we have been working on the plan as early as the beginning of May, together with the Department of Health in the province.
Yeah.
So that is why we're confident that for us, it's really all systems go. It will just be monitoring the rollout of of the systems we have put in place and make sure that we make timely interventions whenever there are problems. In the province, there are about 70 vaccination sites, which have been identified by the Department of Health. And in these sites, there will be stations that will be dedicated for the vaccination of educators. So we're not expecting a situation where educators will have to join the ordinary queue for them to be vaccinated. We have done that precisely because we want to ensure that there is a minimal disruption of teaching and learning. So there will be schools that will be coming on the first part of the day, and there will be schools that will be coming on the second part of the day. We are also discussing and checking the possibility of ensuring that even over the weekends, particularly on Saturdays, we continue to vaccinate our educators. We've got quite a high number of people to be vaccinated. It's 127,000 people that we expect to be vaccinated in the province, the highest, obviously, in the country in terms of the sector.
Yeah.
So we are going to be ensuring that we roll out with the precision that it requires, so that we don't create unnecessary anxiety amongst the educators.
Yeah, in fact, that was my next question in terms of the numbers that you're looking at, particularly in your province, in KZN. As of course we've heard from the minister that nationally that number is at 582,000. But with that large number, given the fact that out of all the provinces, as you point out, that is the largest, you obviously are anticipating some challenges. There are some challenges that you'll obviously have to confront, and I wonder if you've started to think about those challenges and how you will then deal with them. And one of those issues, and you touched on it briefly, you said, it's voluntary for the teachers to get vaccinated, but the reality is there will be some hesitancy, and this might also add to some of those challenges that you might have. MEC, talk to us about how you plan to go about some of those that you might have to maneuver around.
Well, we are quite correct that there may be those educators who will be hesitant in terms of getting vaccinated. But so far, the excitement is quite huge. Teachers are really upbeat, and they are ready to be vaccinated. Yeah. And that is why we are starting an activation program tomorrow, working together with unions and SGPs, because it is important that at this stage we communicate one positive message as the sector. We will not want a situation where the department communicates something that is different from what is communicated by union leaders. That is why tomorrow we are coming together to ensure that we communicate this positive message, and it will not just be a once-off thing. We'll be going to different districts over the vaccination period to ensure that we encourage educators to come forward and vaccinate. Part of the problems that, or amongst the problems that we are anticipating, will be obviously the movement of educators, particularly in rural areas such as Umkanyagu, Zululand, and other parts of the province. We know there are schools that are a bit distant from the vaccination centers, and some educators use public transport for them to travel from home to school. So we have put in place measures such as where there are such issues, the district offices will be on standby to ensure that they assist in terms of the movement of those educators. But in certain schools, Flo, we have decided that we will allow a situation where a school will close at least for one day for all the educators to be moved and vaccinated, and then start the following day, because really some educators stay a bit far from school. So we'll have a situation where an educator will travel from home to school a bit distance, and from a school to a vaccination center is another distance. And it will be quite unfair to expect that immediately after vaccination you'll have to go back to work, because you will also know that there's some kind of a period where health officials or practitioners will have to observe those who are vaccinated to check if they are reacting or they are demonstrating some kind of discomfort. And you don't expect that a number of educators will then have to go back to school immediately after that. But those will be on a case-by-case basis, so it's not just a blanket approach. So there are schools, for example, that will be expected to start from the morning, and midday they then release learners so that educators can then go on the second part of the day to vaccinate.
Yeah, all right, understood. Thank you very much for giving us your time, MEC, and of course I think good luck then for tomorrow as you start that vaccination drive for teachers and support staff. Thanks, sir.